Hi there. So a frequent question that we receive in the lab from patients is what is embryo grading and how is it done and what does that mean for my embryos? For me to explain that process, I find it best to actually show some real life embryos and walk you through how I might go through the grading process and then what that means kind of from a practical perspective in the lab. And so there are three important components to grading every embryo. And so if I bring you in here, we can see three different embryos. And to me, all of these embryos are really equally beautiful. I think they're great embryos, but I would grade them differently. And so the first component that we look at when we look at every embryo is the relative expansion of the embryo. We use number grading 1 through 6 to grade the expansion. 1 being the least expanded and 6 being fully expanded and ready to hatch out. And so when we say hatch out, it means the embryo will hatch through the outer layer of the shell, so that will be the zona pellucida. The embryo will hatch out of the shell and be ready for implantation. Now the second component that we look at would be the inner cell mass. So we can see here on each of these embryos, we have this tight clumping of cells. That would be the inner cell mass. Now we grade the inner cell mass with letters, and so A is the best grade that we give, B is the second best, and so on. And so the last thing that I would say is the inner cell mass is the cells that give rise ultimately to the fetus. And now on the third component would be the trophectoderm. And so this is the outermost layer cells. These cells go on to give rise to embryonic tissues. So this would be things like the extra embryonic tissues would be things such as the placenta that support the pregnancy. Now we also grade the trophectoderm with letters, and so A being the best, B the second best, and so on. So when I look at these embryos, I can see immediately that the bottom embryo here is the most expanded. And so to me, what I would say is this is a 4AA embryo. This embryo is fully expanded. It looks like it's actually about ready to hatch. The inner cell mass is very tightly compacted, very clumped together. It's exactly what I like to see. This is why I'm calling this embryo an A. Now the final component would be the trophectoderm. I'm also giving this an A. When I look at these cells, they're clearly divided. I can see that they're very differentiated. In the lab, we would term this as scalloping or cobblestoning. This is something that we really like to see from an embryo. Now if we move then to the top embryo, we see that the inner cell mass is quite large, but it's not really quite as compact as that bottom embryo. The expansion of the embryo is slightly smaller, and then there's a little bit less of that cobblestoning on the trophectoderm. So I might grade this embryo a 3BB. Now, why does that matter? Well, I did say that they're very similar embryos, and I think they actually do have similar reproductive potentials, but it does change how I'll approach these embryos from a practical perspective. Now, the bottom embryo, I would feel very confident in biopsying this embryo right now without damaging cells. Now the top embryo, I'm a little bit hesitant. I'm not really sure and 100% certain that when I go in to take away cells that I might not damage some of those cells. So what I would do is potentially push this top embryo for an extra day of culture just to allow it to continue to divide and continue to expand so that maybe tomorrow it looks similar to this bottom embryo and I feel much more confident in biopsying. Now, again, even though these embryos are at different stages and they're different grades, it doesn't mean that they're significantly different in terms of their ability to lead to a live birth. So even if an embryo is a different grade, this is more for us in the lab to identify embryos and give us a better sense of a snapshot in time of what these embryos what developmental stage that they're in. So I hope this is helpful for you to understand how we go through the grading process and what that really means for us on a day-to-day basis.